And if you have not addressed the nerve component, I highly, highly recommend that you do, because this is almost always the missing piece, the missing link to getting you out of pain. Hey everybody, so today is episode 100 of Daily Doc Talk, and you know, it's been a few years that I've been doing this now. I think in total probably like a year and a half actually, but 100 episodes is just crazy when I really stop to think about it. And so I wanted to use this opportunity for Daily Doc Talk episode 100 to talk about something that I think is just a prevalent theme in the pain management world, and in this kind of connection between what patients think is going on, how they approach talking with their physicians, and what the physician ends up doing for treatment. And so let me step back for a second and walk you through a little story. So my dad has recently been having some what appeared to be some tennis elbow symptoms. So the outside of his elbow has been bothering him for probably the last 2 to 3 weeks, likely due to some things he's doing at work. Now, he's had tennis elbow in the past, and so he kind of had a rough familiarity with it, understanding that, you know, pains on the outside of the elbow, hurts when he does things with his hands and his forearms and things like that. However, the interesting thing is that, you know, him and I were talking the other night, and I was asking how things were going. He was doing some, you know, exercises that he had in the past. He was wearing that little brace thing that they put here, which basically just creates a new kind of insertion point for the extensors on the forearm. And he, you know, I asked how things were going, and he said that things were getting worse and they weren't really getting better. And so I start talking through this kind of stuff and asking how he's doing. And, you know, the other things that come up are, you know, icing was only moderately helping. And the other big thing for me was that he was taking ibuprofen and it wasn't helping. And this band was not helping at all. So, you know, one of the comments he made to me was that, oh, this is, you know, I know that this is tennis elbow, but I'm just not sure what to do about it. And that right there, I think, just really hit home with me in terms of the approaches that we have in the pain management world. So first off, I haven't done a physical exam on him, but I suspect that this is actually not a classic case of tennis elbow, whether you want to call that lateral epicondylosis, epicondylitis, or just a tendinopathy. But I don't think that's what's going on, because in those cases where we do have true inflammation, when we have epicondylitis, or we have a degenerative condition where we have epicondylosis, in both of those scenarios, ibuprofen almost always helps the pain. Now, it's not a cure, it doesn't last forever, it's temporary, but it almost always drops pain levels, okay? The other thing is, if we do have inflammation at the actual insertion or the enthesis of the extensors onto the lateral epicondyle, then we would see an improvement when we place that band around the lateral aspect of the arm to create that kind of new anchor point, because that decreases tension on that enthesis, the insertion. So I don't think this is epicondylosis, epicondylitis, whatever we're going to call it. However, I do think that this is a neurogenic inflammatory condition, right? We have the radial nerve that's wrapping around on this lateral aspect of the arm that can get caught in supinator muscle, and that can cause pain on the lateral aspect of the arm that can actually mimic lateral epicondylitis or epicondylosis. And so just the fact that there has not been much education out there on these peripheral nerve entrapments that can contribute to pain and how their presentation differs from that of a traditional tendinopathy, there's just not a lot of information out there. And so a lot of providers, a lot of physicians, therapists, you know, everybody in the healthcare space, and then you have the patient, and if nobody is understanding that these nerves can cause issues, then nobody is going to start addressing the nerves. And so We started to, with my dad, work on a few things for nerve health. We started him on a good B complex, especially focusing on higher doses of P5P, and then some magnesium, again, one to help with some of the muscular tension around the nerves, but also two that can help with just generalized nerve health. And then the other thing that we're going to do is obviously stop wearing the band, because if we have that band around here, that can actually worsen the compression on the potentially entrapped nerve. And then we're also going to do what Kelly Starrett classically or famously named Voodoo Flossing. So we're going to take, and I actually have some, actually like my third or fourth video on YouTube if you want some good times. This was like 2016, I think. Scroll all the way back and you'll find some Voodoo Flossing or some NMF flossing on the elbow that I did with Dr. Billy Mitchell. Give a shout out there to Dr. Billy. But so we're going to do some flossing, which is basically some compression around the elbow and then going through range of motion to try and help to free up some potential fascial adhesions between the nerve and the surfaces or the tissues that that nerve has to go through. Because if we can free up some of that, get some new blood flow in there, decrease pain sensitivity, then we can see an improvement in that neurogenic inflammation. If he was in office, obviously you know what I do. I'd use some needles, but we do some nerve hydrodissection, probably of that radial nerve as it's passing through the supinator, but also probably up a little more proximal, because most of the time the issues are going to be a little more proximal to the elbow, coming down and causing that lateral elbow pain. So in a nutshell, nerve inflammation needs to be talked about, and there needs to be more education on it, because I believe it is the huge missing piece of chronic pain in this country and Canada and around the world. When therapies for what you think you have are not working, and if you have not addressed the nerve component, I highly recommend that you do, because this is almost always the missing piece, the missing link to getting you out of pain. See you later, guys. Happy episode 100.